ANA, anti-nuclear antibodies. In which diseases and which autoimmune diseases are they increasing? This is written by Dr. Cleopatra Zumboulis, molecular biologist, MedLab News. Antibodies are agents of the immune system which are produced during the attack of infectious agents and toxins. Their mission is to destroy substances harmful to the body, of course. Anti-nuclear antibodies are pathological antibodies that the body itself creates against its own tissue. Autoantibodies. Antinuclear antibodies, ANA, are increased in many diseases. The diagnosis is combined with the evolution of the symptoms and the other laboratory findings. The ANA test is ordered to help screen for autoimmune diseases and is primarily used as one of the tests to diagnose systemic lupus, erythematosus, SLE. Depending on the patient's symptoms and the doctor's suspected diagnosis, ANAs may be ordered along with one or more autoantibody tests and other laboratory tests related to the presence of inflammation, such as erythrocyte sedimentation rate, ESR, or C-reactive protein, CRP, may also be ordered. ANAs may be accompanied by additional tests which are considered subsets of the general ANA test and are used in conjunction with the patient's clinical history to help rule out other autoimmune disorders. ANAs are mainly increased in autoimmune systemic diseases. There are several types of ANA which several times can help us distinguish some immunological diseases with common clinical characteristics such as SSA, SSB, SM, RNP, SCL70, JO, ANCA, anti-DNA, etc. Diseases with the presence of ANA in various titles are systemic lupus, Sjogren's syndrome, rheumatoid arthritis, autoimmune hepatitis, scleroderma, polymyositis, Addison's disease, idiopathic thrombocytopenic purpura, Hashimoto's thyroiditis, autoimmune hemolytic anemia, type 2 diabetes, viral or chronic bacterial infections, lung diseases, pulmonary hypertension, gastrointestinal diseases such as ulcerative colitis, Crohn's disease, some cancers, skin conditions, especially when they are extensive, such as psoriasis, some medications such as procainamide, hydralazine, and dilaptin, and the percentages where they are found increased in the respective diseases are shown below. Systemic lupus 93%, scleroderma 85%, mixed connective tissue disease 93%, polymyositis, dermatomyositis 61%, rheumatoid arthritis 33%, Sjogren's syndrome 48%, medicinal wolf 100%, lupus discoid 15%, chronic arthritis 71%. They are also increasingly found in diseases of specific organs due to autoimmune activity such as Hashimoto's thyroiditis 46%, Graves' disease 50%, autoimmune hepatitis 63 to 91%, primary biliary cirrhosis 10 to 40%, primary autoimmune cholangitis 100%, idiopathic pulmonary arterial hypertension 40%. Other conditions associated with increased titers of antinuclear antibodies are chronic infectious disease such as monocytosis, hepatitis C, hypoxic bacterial endocarditis, tuberculosis, AIDS, etc. Antinuclear antibodies are rarely raised in cancer. Even patients taking medications can have elevated ANA without developing the picture of medical lupus. Caution: there is no association of ANA with CRP, alcohol use, smoking, education level, and family economic level. From a practical point of view, ANAs are usually sought in conditions that cause arthritis or chronic polyarthritis. If they are found positive in a titer above 1/160, then the first disease that should be looked for is systemic lupus. because it's also the condition in which ANAs occur in a percentage of over 95%. The immunosuppression and taking steroids, anti-nuclear antibodies are falsely negative. False positive ANAs are mainly found in women and elderly people. In these cases, the ANAs are positive but at low titers. Also, taking medications such as acetazolamide, carbidopa, and there's too many here for me to say. From the above, it follows that ANA are simply indicative of the existence of a disease and not the proof, while the same applies to the lack of increased ANA titers. Correct pathological examination is crucial to the correct differential or diagnosis. And this is from a microbiologist. I've translated this for you from a Greek article. Please leave your comments, and thank you for your support. Finally, support my Patreon account. The daily posts are 5 videos daily, and they are totally different from what I have on my YouTube channel. Thank you so much for your support and that you find all my content so interesting. You'll find the Patreon account details in the description box below.